So here we're going to demonstrate dry needling. Dry needling is a technique we use very, very often in clinic, and it helps reduce tension in muscles that can cause pain, and it can restore, we'll say, muscle function as well. So we'll keep it very general for the purposes of this video, and we can talk later on down the road about particular uses. All right, so today I'm just going to demonstrate here on the muscle on the neck, on the side of the shoulder, upper trapezius with Stephen. So we swab down the area with a bit of alcohol. We use a needle, a filament needle, and people ask, are they the same as acupuncture? They're tiny, thin needles. This one is 0.3 of a mil wide, and it happens to be 4 centimeters long, this particular one, and they're inside in this plastic tubing. So what we do is we know with this person there's tension in the neck, okay, and that can be caused by stress, posture-related stuff, or an injury, okay, and maybe we causing pain or a problem or limitation in neck movement, okay. So I'm going to feel across the line of the belly, the muscle, find my tender points through it, and say, right, we know that there's a tension spasm point there. It's called a trigger point, which is a knot in the muscle in normal lingo, okay? And I'm feeling that it's under my fingers there, and then I'm going to pop the needle in, okay? And then Stephen knows and expects that there's going to be a twitch response. So that's a strong involuntary muscle spasm because the needle relaxes that tension down, okay? And we just work that needle around a few times. This is one particular approach to needling. You can also just put several needles in certain positions to help relax general pain and achiness and soreness, and that's called static needling. This is called dynamic needling if you work it in and out at different angles looking for the twitch response, okay? So we just let that sit there on that side. All right, and the other side then, so you'll just see that the needle is left in. There's still quite a lot of the needle out of the muscle, okay? And it doesn't cause any pain once it's settling. Then we have a feel on the other side of the other trapezius, and you might be able to see a twitch, but you're probably a little bit far away. But now in the needle goes, I'm going to work through there's tiny little few twitches, a couple of twitches in the muscle, and we leave those settled, okay? We try not to treat very, very strongly at the start. We keep it nice, gentle treatments to get maximum return, maximum pain relief, and maximum reduction of tension, okay? So we leave those sit for a little while, and you could potentially treat somewhere else, but that's all fine. And then we'll check Stephen's neck movement after the session, okay? So that's dry needling for this area.